Hello and welcome to The World Now. We begin this hour with the latest on the novel coronavirus, which has continued its march around the globe, despite travel restrictions aimed at curtailing its spread. But hopes of a coordinated monetary response by central banks lifted world markets following last week's heavy losses. United States has also recorded the second death and 88 cases. South Korea announced 599 new cases, bringing its total to 4,335 with 22 deaths. Now in China, the number of new cases was 202, bringing its total to 80,026, including 2,912 deaths. We have more in this report.
South Korea said it had confirmed 599 new cases, for higher than the daily tally reported in China, with 4,335 confirmed infections and at least 22 deaths. South Korea has the second largest national caseload. However, it has tested more than 100,000 people, far more than most nations. Education Minister Yoo In-hai said his country will postpone the start of the semester for all schools by 2 weeks.
The government will postpone the start of kindergarten, elementary school, middle school and high school nationwide by 2 weeks to 23rd March from 9th March.
Indonesia, one of the few large nations thought to be free of the virus, said today that it had 2 confirmed cases, marking the first confirmed cases in the world's 4th most populous country.
There has been an increase of another 3 people, taking us now to 9 in New South Wales. One of those people was a gentleman who flew in from Iran, so it's another connection from Iran on the 29th, which was, of course, Saturday.
Australian health officials also said that a woman and a male doctor have contracted coronavirus, becoming the first cases of community transmissions in the country. It's not clear whom it contracted the virus from, but the 41-year-old woman was tested after her brother returned to Australia from Iran.
That there has been an increase of another 3 people, taking us now to 9 in New South Wales. One of those people was a gentleman who flew in from Iran, so it's another connection with Iran, on the 29th, which was, of course, Saturday.
While Australia has moved to stop the spread of the virus by restricting entry to the country for some nationalities, Prime Minister Scott Morrison said last week a global pandemic was likely. As this disease continues to impact the global economy, Delta Airlines Incorporated on Sunday also said it's suspending until May flights to Milan in northern Italy, where most coronavirus cases have been reported. American Airlines Group Incorporated also announced a similar move late on Saturday. Italy now has more than 1,600 confirmed cases, while Iran is nearing 1,000 with more than 50 deaths. Stock market staged a cautious recovery in Asia and Europe. Still, investors appeared set for a choppy week as fears grow that consumers could curb spending.
Nigeria, there has been no new case of coronavirus in the country, apart from the Italian who tested positive few days after his arrival to the country. Now, Minister of Health Osagie Ihanire confirmed this moments ago at a press briefing and also said that the 4 Chinese quarantined in Plateau State also tested negative of the virus. He said other passengers who arrived the country on the same flight with the Italian have been identified and are under close observation. He urged Nigerians to desist from spreading false information as all rapid response team units have been activated. The minister pledged to bring the citizens up to speed with relevant information as they unfold.
As at the 1st of March, there is no new confirmed case in Nigeria. About 13 or 14 tests have been done, and except that one patient, no other person has been diagnosed. It is important for all Nigerians to focus on the facts and not on fear and not to generate panic.
And with me in the studio to discuss this issue is a public health expert and CEO of healthcare group Bola Olaosebikan. Also joining me on Skype is a Global Affairs Analyst, Nweke. Many thanks to the both of you for joining us at this hour. Let me start with you, Bola Olaosebikan. Now, we just had the Minister of Health, Osagie Hanire, saying that there is no new case in the country. What does this mean for us at this moment?
Well, it's a good scorecard that there's no new case at the moment. In a country of over 180 million people, we only have one case, and that case also is not a Nigerian. It's an Italian citizen that came to Nigeria to do business. So Nigeria has got coronavirus, and the system on ground is very good. The medical vigilance system in the country is very good. The system in Lagos is very good. Thank God, every disappointment is a blessing in disguise. Ebola that came in 2014 has triggered a massive biosecurity plan in Lagos State, and it is actually working. Kudos to Lagos State government, to the master plan, to the health system. And the federal authority too are working very hard. They have budgeted 620 million to tackle this coronavirus issue. They've disbursed funds. It's left for the operators at the various alert points, especially at the airports, to do their duty according to their oath of office. The Port Health Authority must work very hard. The Port Health Department must work very hard, whether airport, whether seaport, wherever the port of entry, because this disease is a traveler's disease. It's not a local disease. It's a disease that has to be imported before it comes to Nigeria.
All right. Let's bring you in now, Nweke. When you look at the Global Health Security Index released by the Johns Hopkins Hospital, it says that no country in the world at all is prepared for epidemic outbreaks. Now, why are we not practicing preparedness?
Well, I am not 101% sure that we are not practicing preparedness. I mean, if I could, for a moment, key into the analysis made by the expert on the field, who incidentally is there with you on in the studio. What we have seen as far as the response of Nigeria is concerned to this coronavirus is very, very excellent practice. Now, coronavirus is something that the world has never seen before. But you see, the world didn't need to see it before to be able to project and foresee such situations coming up and be prepared based on previous experiences to be able to respond appropriately. And Nigeria has responded appropriately in this case. Now, the World Health Organization, warning regarding preparedness tend to go towards this creation of unnecessary fears. Because unlike what the Nigerian government did, it is important to reassure people. It is important to let the public know that, yes, it hadn't happened before, but based on precedents of other diseases, other viruses that was unknown to mankind and responded to adequately, this will be battled and it will be a thing of the past. So, yes, Nigeria has done well, and it is important to stop spreading fear and base this on science and base this on research.
All right, you were giving Nigeria, scoring Nigeria high on this, but let's look at this globally. What level, because again, like the expert said, in the studio, this is a traveler's disease in that it originated from China, and for every other country, you basically have to travel to get it in. So what level of coordination would you like to see in terms of international movement? What level of global coordination would you want to see on that?
Yes. Well, I have seen a number of countries, respond by, giving negative travel advice. Some have also, stopped flights going to certain countries and so on and so forth. Well, these are choices that, governments have to make. But I want to make one point very clear. And that point is that a virus of this nature should not give politicians opportunity to start playing some political games with it. I think it is important to listen to science. It's important to listen to experts in this matter. And what I have heard the experts talk about is containment, but also prevention. Now, to avoid a massive global spread, I think that containment, just by testing, like we have seen in the case of Nigeria, how they responded, but also quarantining quite a number of people. I believe 14 of them, going by the report you gave earlier. These are bits and pieces of steps that actually go right to the heart of the issue.
All right. Mr. Collins, I'm afraid I do have to put you on hold. Now, back to you here in the studio, because again, we're listening to Mr. Collins talking about, travel, what we have to put in place in terms of travel. But there are people who still do not understand this disease at all. When you talk to people, most of them don't even know what coronavirus is about. And some also have a level of misinformation. Some say, it has something to do with the weather. Others say, when you wear face masks. So tell us more about this disease.
Well, basically, coronavirus is it's in the range of what we call rhinoviruses. These are infections of the nose. It causes cold, and we had coronavirus before in 2002. We had a coronavirus infection also in China in 2002. At that time, it caused a disease called severe acute respiratory syndrome, SARS. And 10 years again, 2012, another coronavirus attack came to the world, which attacked the air. It's called middle ear respiratory syndrome. So this is the third attack of coronavirus in China. But this one is novel because this strain has not existed before, and that's why it's called novel coronavirus. And it is coronavirus because it looks like a crown. Corona means crown in Latin. So basically, it's violent. It causes fever. It causes sneezing. It causes cough. Whoever has these three symptoms should go to hospital for test. And the most dangerous thing about coronavirus is the dyspneic attack. It makes people to be breathless. By the time it's going to that stage, it's going to a very critical stage where the person has to be admitted, isolated, and there are many uniforms that doctors and nurses have to wear to be able to protect yourself. Personal protective equipment, special dresses, isolation, quarantine. Everybody do not need to wear face mask. You do not have to wear face masks everywhere. And I want to also alert people here that there are too many fake face masks now in the market. There are too many fake sanitizers in the market. So coronavirus is basically a virus. There are viruses. Cold is caused by virus. There are no cure for viruses. Even coronavirus, no vaccine, no cure. The medical treatment we give is supportive, is complementary. We treat fever, we treat pain, we give you oxygen, we give you hydration for your body to conquer, to react. Naturally, there is immunity in our body. Let everybody build their immunity. Let your immunity be strong. The people that are really in danger with this disease are people who are sick, the elderly, and the children. So special care must be given to children. There should be no self-medication for children when they have cold or cough or sneezing. Rush this child to the hospital so that the doctor can test. It's not every hospital that can diagnose coronavirus. It's not every lab, because it's an immunological test. When an antigen, a foreign body, enters your body, a virus or anything, it stimulates an antibody reaction in your body. It is that antibody that will be tested immunologically. And in Nigeria so far, it's only one case that has been confirmed. There's no other case. And there's no Nigerian that has got the disease. So the symptom is cough, sneezing, and if it becomes real disease, you can have infection without symptoms. 80% of people who have coronavirus will not manifest any symptom. It's only 20% that will manifest symptom. And out of that 20%, some of them will have breathing difficulty. But it is very important for every state to be prepared to have isolation ward or isolation hospital. Like Lagos State has an infectious disease hospital. Every state should have an IDH, infectious disease hospital. You don't need to build again. There are many hospitals that are abandoned, that are not being used in many states. You can just take one and dedicate it, like Lagos State has dedicated one in Yaba, which is an excellent structure.
Let's get to you, Collins Nweke. We know that this has taken its toll on the economy, world economy. for the past few days, we've seen markets down, except for today where, there were few announcements that were made. What should we be doing now to mitigate against the impact of this on the global economy?
Well, I do wish I have good news for you, but unfortunately I don't, because this is, the global impact of coronavirus is going to get worse before it gets better. Now, what we are seeing in China, which is a rising economic power, is, a very serious downturn in, GDP growth. Up to, this time last year, the GDP was growing by 6%. Now it is only growing by 4.5%. So that is huge. And it's estimated that this is going to cost over 4 million jobs in China. What that means is that it's going to have a ripple effect in the rest of the world. Take Nigeria, for example, because Nigeria does quite a lot of business with China. So the Chinese economy slowing down as a consequence of coronavirus is definitely going to affect the Nigerian economy, because I don't know anyone that is still going to trade in China at this moment, or even goods that were already packed and ready to be shipped to Nigeria. Because of the lockdown in commercial activities, those ones are stuck in the seaport. So I think once all of these play out, account will be taken of the humongous loss that has been incurred, and then the process of economic rebuilding would have to take place. But the priority now is containment, prevention, and then the rest will follow eventually.
All right, very extensive conversation here on the coronavirus. Many thanks to our guest. With me in the studio was the CEO of Healthcare Group, Bola Olaosebikan, as well as the man who joined us from Skype, Global Affairs Analyst Collins Nweke. Many thanks to both of you. Now we'll have more on the deadly coronavirus from different countries after this break. Stay with us.